Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's February 5th, and we have a lot to talk about. First off, I want to thank all of you who have accepted my invitation to share your thoughts, your feedback, and your suggestions for topics that we might talk about in future episodes of Real Talk MS. I know I've said this before, but I think of the podcast as a conversation. And that means that you have a standing invitation to participate in that conversation. So if you and I haven't connected yet, I'm inviting you to send me an email at john@realtalkms.com. That's JON@realtalkms.com, or you can call me. Just a couple of weeks ago, I set up the Real Talk MS listener hotline so that connecting with the podcast can be as easy as making a phone call. The number in the U.S. is area code 310-526-2283. So shoot me an email or call the listener hotline and share your thoughts and suggestions. You know, when someone is diagnosed with MS, it's highly likely that the neurologist is going to talk with them about the importance of starting disease-modifying drug therapy. But what isn't usually discussed at the time of diagnosis is the importance of a rehabilitation plan. Getting assessed and developing a rehab strategy with a rehabilitation specialist. And if we think of it at all, we tend to think of rehabilitation as something that might have to happen later. Well, that kind of thinking actually works against us. My guest today is Dr. Deborah Backus, the Director of Multiple Sclerosis Research at the Shepherd Center in Atlanta. Dr. Backus is an experienced physical therapist, educator, and researcher who's focused on improving functional and health outcomes for people living with MS. We're going to be talking with Dr. Backus about a really interesting clinical trial that she's heading up that just might prove to be a game changer when it comes to MS rehabilitation. But before we get to my conversation with Dr. Backus, there are a few other things that you should know about. The practice of using 5 or more medications simultaneously is known as polypharmacy. It's a practice that's been growing in the general population, and it's something that people living with MS should be sure to communicate to their neurologist and all of the other doctors who may be treating them. People may take multiple medications for, multiple reasons. As we all age, we're more likely to have comorbidities. That's multiple medical conditions that we're dealing with all at the same time. And we may end up treating some or all of those comorbidities with prescription or over-the-counter medication. So the number of medications that we may be taking at the same time can increase pretty quickly. And if you're living with MS and you consider the multiple symptoms you may be managing, it's likely that you're taking multiple MS medications besides your disease-modifying drug therapy. And don't forget that people living with MS are still susceptible to comorbidities, so you can easily fall into the large group of people who are living with multiple sclerosis and are practicing polypharmacy. In fact, a research team in Germany investigated polypharmacy among people living with relapsing remitting MS. They recruited 145 people living with relapsing remitting MS and found that about a third reported polypharmacy. And one interesting fact that emerged from this study was that after disease-modifying drug therapy, the most often used medications were dietary supplements. And this should serve to remind everyone that when you talk with your doctor about the medications that you're taking, please remember to include over-the-counter dietary or herbal supplements. When you fail to mention these non-prescription supplements, you put yourself at risk for dealing with potential side effects that can be caused by the interactions between these supplements and other medications that you might be taking. This study also showed that the people living with relapsing remitting MS and polypharmacy were older, with an average age of about 46, compared to an average age of about 42 among people without polypharmacy. And twice as many of the study participants with polypharmacy were retired. About half of the study participants had comorbidities, with thyroid disease, gastrointestinal diseases, and spasticity topping the list. And the study participants without polypharmacy had lower EDSS or disability scores. The results of the study point out that people living with relapsing remitting MS, who may have a higher level of disability or other secondary illnesses, are likely to be affected by polypharmacy. And that means that they have an especially important need to share all of the medications that they're taking, both prescription meds and non-prescription over-the-counter supplements, with each of the doctors that they're seeing. A couple of weeks ago, Dr. Aaron Boster was my guest on the podcast, and we talked about an important conversation that everyone living with MS needs to have with their neurologist. Please be sure to add this important information to the list of things that you should be communicating to your neurologist and every other doctor who may be treating you. If you'd like to review the details of the study, I'll include a link in today's show notes. Some of the biggest challenges that MS poses are the logistical challenges. If you're living with progressive MS, then you already know the detailed planning that's required if you're going to be doing any traveling. But these logistical challenges can also be found locally in the everyday chores and activities that we all need to get done. Something as basic as just getting to an appointment with your neurologist or getting to an MS center to receive treatment can present logistical challenges that, in the end, cause some people to just skip that appointment. And that's never the best idea. So MS Focus, that's the Multiple Sclerosis Foundation, is testing a new transportation pilot program in Miami-Dade, Broward, and Palm Beach counties in Florida. They've partnered with ride-sharing company Lyft to provide free rides to get people living with MS to their appointments with their neurologist or to an infusion center or to get treatment at an MS center. I don't have too many details about this pilot program yet, but I hope it proves to be viable. I've actually been hoping to see something like this being tested for quite a while because it looks like it could be a solution to those logistical challenges of getting from point A to point B. And when point B is your neurologist's office or an infusion center, well, you don't want to miss those appointments. So we'll keep our fingers crossed and we'll keep you updated on how this pilot project is working out. We've talked before about how my role as my wife's caregiver has transformed to being her advocate. If you're a new listener, the short version of the story is that my wife Jean is living with a particularly aggressive case of progressive MS. I stopped working for about 10 years to serve as her primary caregiver, but unfortunately Jean reached a point where she could no longer be cared for at home. She was first transferred to a skilled nursing facility, and then she was transferred to a subacute nursing facility, which is a nursing home that's about a half a step below a hospital and a half a step above skilled nursing. And as Jean entered the nursing home system, I realized that she needed a strong advocate. I observed that the quality of care changed from day to day, from shift to shift, depending upon which nurse was caring for Jean at any particular time. And since I visit her daily, this was an easy role for me to assume. Now, in past episodes of RealTalk MS, I've talked about the importance of being an advocate when someone is hospitalized or admitted to a nursing facility, and I thought I'd share something that happened last week at Jean's nursing home. I probably don't have to remind anyone listening that high temperatures exacerbate MS. People living with MS do worse when they get too warm, And this has been especially true for Jean. And so I printed a sign that's taped to the wall. It's directly over her head. And the first thing it says on that sign is, per responsible party. That's nursing home speak for per me. No blanket. And it says this in pretty big letters. And the reason it says this is that I've observed that even an ordinary blanket will cause Jean to overheat, and quite honestly, she can't really afford to let her symptoms get worse. So covering Jean with just a top sheet is enough to keep her comfortable. So last Friday morning, I walked into Jean's room, and I could see that her face was extremely flushed. She wasn't very responsive, and when I felt her skin, it was hot. Now, there was only a top sheet covering her, but when I looked toward the foot of her bed, well, there wasn't one. There were actually 2 blankets that had very clearly been used overnight. So I had a quick meeting with the charge nurse, and I impressed upon her that while I didn't expect anyone on the nursing home staff to cure my wife, I also didn't expect them to take deliberate actions that would make her worse, like covering her with 2 blankets for the night. I explained how people living with MS react to getting overheated, and I asked what more I could do beyond having the sign posted right over Jean's head, a sign that was obviously ignored the previous night. Well, the charge nurse was very responsive to my concern and assured me that she would communicate the no blanket rule with the night shift nurses, which sounded fine, but I have a lingering doubt. I'm sure this is going to solve things most of the time, just like my sign works most of the time. But as Jean has been at 5 different nursing facilities now, I've noticed something that they all seem to have in common. They have 2 different kinds of people on staff. Some are committed to caring for their patients, and they do an admirable job. And then there are some that have learned to go through the motions of their job without once ever actually seeing the patient. Unfortunately, I never know which kind of nurse will be caring for Jean on any given day, so my role as Jean's caregiver has taken on a new meaning. It means that I'm there to make sure that she's receiving the best possible care. And on the days that she isn't, well, my role as her advocate is to fix that. So while we're talking about my role as Jean's caregiver, I'll also share something that I didn't always do particularly well. And that was caring for the caregiver. I spent a lot of years caring for my wife at home, and in that time I learned how to be a pretty good caregiver. But I learned how to do things right by first doing an awful lot of them wrong. And when it came to self-care, I, like, well, so many other caregivers, didn't put that at the top of my list. In fact, last year, Merck published the results of a global survey of caregivers titled Living with Multiple Sclerosis, The Carer's Perspective. And that report showed that 28% of the respondents found that being an MS caregiver had negatively impacted their own physical health. And another 43% believed that it had negatively impacted their mental and emotional well-being. But failing to care for the caregiver comes at a cost. And for me, that bill is now coming due. In the decade that I spent as Jean's primary caregiver, one of the things that I overlooked was getting to the dentist. I felt as though I had my hands full dealing with Jean's particularly aggressive case of MS, and I just never found the time for things like my own dental appointments. So if we can fast forward to today, I'll be undergoing some extensive oral surgery next week. And in that procedure, I'll be losing a few of my lower teeth and most of my upper teeth. Now, this isn't something I'm happy talking about, but the information that I share with you on the podcast isn't going to be worth much if I'm less than honest. And this is a real-world example of why you don't want to do what I did then. And if you're an MS caregiver, you need to remember the very excellent advice you receive just before you take off in an airplane. Be sure to adjust your own mask first, and then assist others with theirs. So I'm going to try to record a few podcast episodes this week in advance because I won't be able to speak very well for the next couple of weeks following my surgery. Hopefully all will return to normal soon, but I feel like I have to salvage something positive out of this self-inflicted negative situation. So at the very least, I thought I could make it a teaching moment. Researchers at the University of Washington are recruiting 250 people living with multiple sclerosis who have chronic pain for a clinical trial that's going to test two non-pharmacological approaches to managing MS-related pain. Chronic pain is often linked to MS, and it's one of those symptoms that gets in the way of pursuing a reasonable quality of life. It's been linked with depression, it disrupts your sleep, and it has a negative impact on your life at work and your social life. And treating pain with drugs doesn't always do the job. It doesn't always provide complete relief from the pain, and it opens the door to unwanted side effects. Now, one non-pharmacologic approach to managing MS pain is cognitive behavioral therapy, or CBT, which has been shown to reduce the intensity of MS-related pain. Another approach is mindfulness-based cognitive therapy, or MBCT, which integrates mindfulness meditation into a CBT sort of framework. Now, this clinical trial is funded by the National MS Society, and it's designed to compare the effectiveness of cognitive behavioral therapy and mindfulness-based cognitive therapy in managing MS-related pain. The research team is recruiting people throughout the United States who are diagnosed with any form of MS, who are at least 18 years old and have chronic pain. And chronic pain is being defined here as daily pain for more than 3 months, with an average pain intensity of a 3 on a scale of 1 to 10. Participants should have access to and be able to talk over the telephone, and they should have a computer or a digital device with internet access. If you're interested in participating and you'd like to learn more about the eligibility details, you can send an email to msadapt@uw.edu. That's MSADAPT, msadapt@uw.edu. Or you can call them at area code 855-320-8230. And I'll include that email address and phone number in today's show notes. Today we've touched on different approaches to managing some of your MS symptoms, but the best way to manage an MS symptom is to proactively limit its effect on you. And one of the best ways to maintain function and proactively manage the effect of some MS symptoms is exercise. In a moment, we'll meet my guest, Dr. Deborah Backus, the Director of Multiple Sclerosis Research at the Shepherd Center in Atlanta. We'll be discussing the importance of early rehabilitation, the difference that exercise can make for people living with MS. And Dr. Backus is going to tell us about what I consider to be a really exciting clinical trial. People living with MS don't often measure disability or disease progression by looking at an MRI scan. They measure it in terms of lost function. Whether it's mobility, cognition, fatigue, pain, or any of this seemingly endless list of potential symptoms of multiple sclerosis, people often conclude that their MS is progressing when their symptoms get worse. And that's why rehabilitation is such an important topic, because the goal of rehabilitation is to improve and maintain function. My guest today is Dr. Deborah Backus, the Director of Multiple Sclerosis Research at the Shepherd Center in Atlanta. Dr. Backus is an experienced physical therapist, educator, and researcher who's focused on improving functional and health outcomes for people living with MS and spinal cord injury. Welcome to the podcast, Dr. Backus.
Thank you very much. Happy to be here.
So, someone's received a diagnosis of MS, and the first thing that their neurologist is likely going to talk to them about is the importance of beginning disease-modifying drug therapy. When should that person start thinking about rehabilitation?
Immediately. It's an excellent question, and often people don't think about this, but they should immediately be thinking about at least getting a consult with a rehabilitation provider, a physical therapist would be great. There's so much that they can learn about how to stay healthy, how to stay conditioned so that they can maybe lessen the effects of whatever symptoms they might be experiencing with MS and maintain their functional ability for as long as possible.
For a long time, physical exercise wasn't the first thing someone with MS thought about. In fact, some people living with MS might have worried that something like their MS fatigue could actually get worse if they did exercise. But today experts have a different perspective on that. We're hearing more and more about exercise and MS. So how important or how beneficial is physical exercise for people living with MS?
It is beyond beneficial. It's critical. One of the common signs, as you already said, is a loss of mobility. Weakness is also another problem associated with MS. And both of those things can be impacted by exercise. Just by safely exercising, someone might be able to keep their muscles more conditioned, might be able to maintain the stability that they need, the endurance that they need to stay mobile longer. And so it's really important that they learn how to exercise safely as soon as they can.
As you talked about someone keeping their muscles conditioned, it reminded me of something that's kind of been on the back of my mind for a while when I think about people who are living with MS who really cut back or stop completely in terms of physical exercise and things like that. By deconditioning their muscles through lack of activity, do they actually make their situation worse than it has to be?
Absolutely. There is lots of evidence showing that as people either lose mobility or lose their confidence in walking and they become less mobile, they actually become less physically active, as you're suggesting. And by becoming less physically active, they become more deconditioned. And that just is going to lead them into this kind of a rapid cycling and further deconditioning. And the exercise, learning how to increase that physical activity and stay active longer safely, is only going to help prevent that secondary deconditioning, not just in the muscles, but the cardiovascular system, blood flow changes with inactivity, and all of those just make people feel worse and less physical activity. So it's just a downward decline.
I think that's really important to stress, so that as someone may become more challenged in terms of their mobility and feel like they're physically able to do less, by doing less, they actually hasten what they're trying most to avoid.
That's correct.
As I said, I think that's just really an important point. And we're talking about people who may be dealing with some sort of compromise in their mobility, people who are living with progressive MS, people who might rely on a wheelchair or a scooter for mobility. Can they still find benefit from physical exercise? And assuming from what you've said that there is benefit, are there exercises designed for them?
That's an excellent question, too. The majority of research related to exercise in people with MS, it does tend to be in people who are still walking. We've done work in folks who are using wheelchairs or scooters for mobility, and we find that they can feel better. Their muscles can respond to exercise. And we don't know if this is going to help prevent the decline in ability. But our hope is that by preventing the deconditioning, improving the strength, improving their cardiovascular function, that they actually will stay healthier for longer. And they'll be able to combat some of the secondary conditions. Even people who are in wheelchairs, even if their goal isn't to walk again, there's no reason why they can't feel healthier. And by exercising, their overall body, their body in general, can be stronger. We know that people who don't exercise and who are in wheelchairs, they're at a greater risk for heart disease and diabetes and a lot of the secondary conditions that will make them less healthy, which will then lead to further lack of participation and affect their overall quality of life. So pretty much anybody can benefit from exercise. The goals might be different, but there's no reason not to try to exercise. The challenge that people who are in wheelchairs or who aren't ambulatory that they face is that there are some barriers to being able to access exercise equipment. It's not quite as easy for them to go into a gym and get on equipment. But if they do seek help from somebody who's an exercise specialist who understands MS or from physical therapy, they can learn the exercises that will work for them. And they can learn which technology they might be able to use to help them to exercise safely so that they hopefully can stay a little bit healthier for longer.
One of the obstacles that can make it more difficult for someone living with MS to get physical therapy is sometimes something as simple as getting to a physical therapy appointment, just the logistics of getting from point A to point B. And that's one of the things that makes the STEP for MS study so interesting. As the study's principal investigator, can you tell us about STEP for MS?
Oh, absolutely. I'm really excited about this trial. It is a multi-site trial where we're trying to compare exercises that are actually based on guidelines for people with MS. And it's actually called GEMS, Guidelines for Exercise for People with MS, based on evidence, based on research that's been done showing the effectiveness of exercise. And this particular exercise program was developed by Dr. Robert Model and his colleagues, where there is both resistance training and cardio training that people will be performing. And a lot of the studies in people with MS have been in a lab setting or a clinical setting. But what we really want to find out is if we use these guidelines, if we do use GEMS in the home delivered with tele-rehab support, can we get the same benefits that we would when it's been delivered in a facility or in a lab setting? The other part about this that's really interesting is that it's not just the exercise in GEMS that's meaningful, but there's actually a behavioral or a coaching component that has been shown to be critical. It's based on theory about how people can change their behaviors, and it's a very big part of this program. So whether they're in the home using the tele-rehab approach or in the facility, participants in both groups will be interacting with coaches, having regularly scheduled meetings with the coaches to talk about the barriers that they personally are facing or that they might anticipate facing to exercise and how they might overcome them, helping them learn how to problem solve so that even when they're dealing with their MS symptoms, they might be able to still get some exercise that would be meaningful, and helping to set them up for a lifestyle that includes exercise and physical activity even after the study ends. So it's really exciting that we can really look at the comparative effectiveness, compare them both to see if we'll get the same outcomes if they all get the same intervention, just in a different setting.
Just to stress what I think is just an incredible aspect of this, the coaching that's going to go on to the part of the study, the people that are taking advantage of the tele-rehab approach who are actually doing this from their home, that's not watching a video that's been pre-recorded for everyone. This is actually a two-way conversation where you're getting coached based upon the issues you may be dealing with or some of the situations you find you're facing. Is that right?
That's exactly right. So the people in the facility will have a meeting with their coach, a face-to-face meeting, not while they're exercising, but a meeting that will go over materials they've received, a newsletter actually that they've received, talking about a significant barrier. Maybe it's getting access to equipment to do the exercises, or maybe it's overcoming the symptom of fatigue and figuring out a safe way to exercise. They'll meet with the coach and they'll talk about that. They'll have 15 to 30 minutes to talk about that specific aspect. The people who are in the tele-rehab or the home-based group, they will get on a conference with a face-to-face conference where they can see their coach and have the same kind of meeting remotely. So they'll go through the same exact materials or the same exact issues, but they'll be doing so, online with that coach. And they'll also all be getting written materials. They'll all have a manual that they can reference when they're having these conversations with their coaches. So they're getting the same kind of support. It's just not face-to-face in the same center.
Well, I think that's fantastic. It sounds like this concept of tele-rehab, if it proves to be effective, can really go a long way toward making physical therapy more accessible and more affordable for people.
And that's our goal, is we really want to break down the barriers to being able to exercise. So the idea is that we're providing some education related to the principles, how to incorporate those into daily life with MS, how to make better and safe decisions about when to exercise and how to exercise with MS. And those can be applied in a facility that's more clinical or in the home or in a community center. And that's our idea, is so that anybody, even if they don't have access to a specialized MS center, should have access to specialized MS care.
I'm going to look forward to following along as your study concludes and we start to see some results. But if someone is listening to our conversation today and they want to participate in the Step for MS study, what should they do?
We actually have collaborators across the country, and in Alabama, the University of Alabama at Birmingham, the University of North Carolina, Chapel Hill, University of Georgia, Cleveland Clinic, University of Colorado in Denver, Marquette University in Wisconsin. All of those sites are participating, and a person could contact those sites. I have a website I can give you if that would be useful.
Of course.
It's www.iconquerms.org, iconquerms.org/welcome-step-MS. And really, if somebody really wants to find it, if they go in online and they put in Step for MS trial, they'll be able to find us. And there they will list all of the contact information for wherever that person might live relative to any of the sites that I mentioned.
And I'm going to make sure that all that contact information is also available in the show notes for this podcast episode. So we'll make it as easy as possible for someone to take the next step and go ahead and get involved with the study.
That would be great. The only qualifications they do for this study, they do need to be able to still walk at least 25 feet. And they have to be willing to go to one of the centers in order to participate. Even though they might prefer the tele-rehab, they have to be able to go to one of the centers. Our hope is that we'll learn from this study and be able to expand this to help people who maybe aren't still able to ambulate. And if we're successful in showing that that the tele-rehab is as effective as the facility-based program, then we hope to disseminate that more widely so that people in other parts of the country, other places, will be able to access it.
Well, Dr. Deborah Backus, the study is incredibly exciting. We've got fingers crossed as it moves forward. First, let me also thank you for all the work that you've done in improving the well-being of people living with MS, and thank you for talking with me today.
Well, thank you, and thank you for the support. I hope we can reach lots of people. I think that what you're doing is so meaningful, helping people access the information they need. So thank you so much for including us.
Well, that's going to wrap up this episode of Real Talk MS. If you haven't yet, I invite you to visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or device. It's the easiest way for you to stay connected to the podcast. You'll never miss an episode, and the app allows me to share all sorts of bonus content with you in the weeks and months ahead. My name is John Strum. Thanks for listening, and we'll catch you next time.